Hello, my name is Shannon Linville Green, and I have written a paper on functional communication training. It's for my class 6183, teaching students with Autism Spectrum Disorders. This is through Arkansas State University. The abstract of the paper. With multiple strategies being introduced to help students with autism spectrum disorder, it is essential to find one that is an evidence-based practice. It is also necessary with any intervention plan to keep consistency throughout the student's school day and at home. Collaboration with teachers, parents, and other school officials is an essential part of determining which practice is best for the student. The Individualized Education Program, also called the IEP, is a document designed for every child in public schools that needs special education services. The IEP is prepared through a team effort of parents, teachers, and other educational professionals. The IEP team is essential in the success of any intervention chosen for the student. The evidence-based practice chosen will be a part of the IEP goals and objectives. The IEP is reviewed and updated annually to ensure any changes needed. Goals and objectives written in the IEP will focus on student success in school and everyday life skills, such as socializing and communication. Communication is so important because everyone wants a voice. And as an advocate for our students, it is vital to provide each child with this appropriate way of communication. Functional communication training, or FCT, is considered a positive behavioral support strategy and an evidence-based practice proven to be an effective way to increase positive communication skills by teaching the child how to replace aggressive behavior with appropriate behavior and receive the same outcome. The IEP will have a written goal and objective about the behavioral intervention, such as John will increase appropriate response with the implementation of the FCT intervention plan and ask for help in a proper language instead of stomping out of the classroom with 90% accuracy. As with most evidence-based practices, observations will be completed to identify the underlying cause of the behavior through a functional behavior assessment. Then after the proper observations are completed, an appropriate alternative means of communication will be selected. The theories discovered through the observation will be put into action. This plan must be consistent throughout the student's day in each classroom and at home. The stress for parents, student, and teacher will be much less if the student can learn an appropriate way to communicate his or her needs and wants. Determining the best approach may take extensive observation and research because ASD can show different in everyone concerning their abilities and disabilities. As educators, we must recognize that each child and their limitations are not the same. We must find ways to individualize each student method to improve behavior and to be able to communicate functionally in everyday life to the best of their abilities. Through the research of evidence-based interventions, we can determine the best interventions for our students. The causes of ASD are unknown. At one time, the theory that the mothers being cold toward their children, which means showing them no attention, was thought to be attributed to someone developing ASD. But with further research, this was proven incorrect. At the present, most believe that genetics and environment contribute to this disorder, although no genes have been discovered that are in relation to this disorder. Some studies show that exposure to chemicals and medications while in utero could be a contribution of ASD. Most students with ASD have trouble maintaining relationships, social interactions, and some are nonverbal. The Individuals with Disabilities Education Act defines autism as a developmental disability affecting verbal and nonverbal communication and social interaction. These disabilities adversely affect a child's educational performance and interfere with daily activities. Autism is generally evident before age 3. The Division for Early Childhood developed recommended practices to provide knowledge about methods and interventions for young children at risk or with a disability. The recommended practices are designed to give practitioners and families the best approaches and information available to improve a young child's learning outcome and to increase the development of young children who may have a disability or be at risk for developmental delays. In Robert's article that was written in 2018 gives 15 classic symptoms to look for signs of ASD. Failure to make friends, selective mutism, inability to empathize, inability to make eye contact or forcing eye contact, social awkwardness, narrowed interest, sticking to routine and getting upset if that routine is messed up, literal interpretations, excellent pattern recognition, and poor motor skills, trouble understanding social cues, repetitive motor mannerisms, abnormal language and speech patterns, heightened sensitivity, and difficulty judging personal space. The earlier the signs are recognized, the previous interventions and strategies can be developed to get the best results for the child. The intent of the recommended practices developed by the DEC is to help bring together the research and the practices by bringing the methods that are the most effective to the forefront in hope of better outcomes for the children with disabilities or developmental delays and their families and the personnel who serve them. Communication is essential to an individual, and one form of communication is through behavior. If the behavior used to communicate is inappropriate, this can be difficult for the child and the people around them. Everyone wants a voice, and we have to find a way to make sure our children are able to communicate appropriately and have that voice. So as educators, we must help this individual find an appropriate behavior to use for communication. Communication is a two-way interaction of trying to reach a mutual understanding. Autism Spectrum Disorder has two main areas. First area is social communication and social interaction. The second area is restrictive, repetitive patterns of behavior, interests, or activities that affect daily functioning. Classic autism and Asperger disorder are both classified under ASD. Children with ASD usually have a language deficiency or may even be nonverbal. As we talk about functional communication training, it's been proven to be beneficial to help ASD students communicate through a non-aggressive manner and substitute these manners into the appropriate language. SCT is an evidence-based practice that has shown a reduction of challenging behaviors in children with ASD. It is recommended practice for students that use aggression as a form of communication and difficulty with social interaction, which can be a significant effect on the child in the school. These aggressive behaviors in classrooms or any social situation can be disruptive and frustrating for anyone involved. Some students with ASD have disruptive behavior because they can't express or request their need in the classroom. Some of them don't know how to say that some of them are attention seeking, where they are trying to get the teacher's attention or the other children's attention. So we want to, once we determine that that is what's going on in the environment, then we need to find a vocal response that would be more appropriate for that child to get attention, like, am I doing good work? And then the teacher could give them positive reinforcement, give them the attention that they are seeking. Some do not want to do the task or can't do the task and don't know how to explain to the teacher, I can't do this. And so they may run from the room, or they may become aggressive, and that's where we either need to use a vocal response to teach them that I don't understand. this is the appropriate way to say, I need help, and I need a break. I can't do this task. We need to, there's other ways of doing it, of implementing through gestures, sign language, pictures. It just may depend on the child, the skill level, how whether they're nonverbal or do have some verbal communication. It is very important. Even further in life, as FCT also teaches, regulation of your communication, regulation of, it's essential because it's self-regulation skills. Early in life, if we can get this under control, it's essential for lifelong success. It helps our students be prepared after high school. It helps them to get a job that they might not be able to get and keep because of their behavior. But if they've had this FCT, if they've had functional communication training, they may be able to self-regulate themselves and use the proper form of communication to maintain the jobs or to have social interactions with other people. Communication is vital, important, essential to everyone. Everyone wants a voice, and behavior is one way some children and individuals use to communicate. Behavior can be appropriate or disruptive, or the individual can be taught through functional communication training to use appropriate action to establish the same outcome. And as being an educator, we have to be an advocate for these students, and we have to research and find the best. We have to know them on a personal level so that we can help them to have improved lifelong skills. Thank you.